Mr. Bachman.
Thank you. My name is Ron Bachman. I'm an actuary and a senior fellow at the Center for Health Transformation. Americans know that a solution is needed to the 47 million people who are uninsured. Any solution must include the sickest among us. No one can be left behind. Any system that works only for the young, healthy, and wealthy is a system destined to failure. According to the Institute of Medicine, 18,000 people die every year because they are uninsured. Uninsured adults have a 25% greater rate of dying than adults with insurance. Simply put, insuring all Americans is a moral imperative. Addressing the uninsured is also an economic development opportunity. Uninsured adults have more absences from work, more unscheduled sick days, and greater rates of disability. 8 out of 10 uninsureds are in working families. The great job creation machine in this country is small business, yet 65% with fewer than 10 employees do not even offer health insurance. Many more Americans are only a pink slip away from losing their jobs and their health insurance. The uninsureds are a symptom of a dysfunctional system. Focusing on the uninsured rather than arguing over general market reforms, I believe, will lead us to new solutions. We have an outdated legal and regulatory environment with unintended consequences that makes little sense to the average citizen. For example, it is illegal for small groups to provide financial rewards to a diabetic following doctor's orders, or incent individuals with financial rewards for healthy behaviors such as wellness, prevention, and early intervention. States add a sales tax to every policy sold amounting to 2 or 3% or more of the premiums. These added taxes only make insurance more unaffordable and increase the number of uninsureds. In 24 states, it is illegal for small employers to contribute to the purchase of individual policies through the use of tax-advantaged health reimbursement arrangements. It is generally illegal under federal law for an unemployed worker to use accumulated HSA savings to pay for health insurance premiums. It is illegal under federal law to provide separate prescription drug benefits under high-deductible health plans. It is illegal under federal law for personally contributed but unused flexible spending account funds to accumulate over time. These are multiple account designs with confusing rules and requirements that make no sense to the average citizen. A collaboration of key stakeholders worked last year to develop recommendations to lower the uninsured in Georgia by 1/3, or about 500,000 in our state. The collaboration effort succeeded. On May 7, 2008, Georgia's Governor Sonny Perdue signed into law health insurance reform legislation that allows insurers to develop significantly more affordable products for small companies and individuals. The new laws focus on the uninsured working poor as a first step. This legislation is estimated to bring an annual increased economic value to Georgia of $1.9 billion. The key to success was moving beyond the first generation HSA-eligible plans to a new generation of consumer-oriented products. Critics have concerns regarding coverage under HSA-eligible plans. The required upfront deductibles have been a problem for many. With new generation plans, these concerns are substantially moderated and potentially eliminated. The new Georgia law is a market-based, individually centered package of reforms that eliminates outdated insurance laws that unintentionally limited the offering of affordable insurance. The new law allows financial dividends to be placed into health savings accounts for engaging in wellness, prevention, and treatment compliance. Rewards and incentives paid into the HSA by insurers can reduce or eliminate the entire deductible otherwise payable by the patient. Affordability is no longer the dollars you take out of your pocket to pay for an insurance premium. Affordability is also achieved through healthy choices and behavior changes. Georgia eliminated all state and local sales tax on HSA-eligible plans. As an incentive to offer insurance, companies with fewer than 50 employees are granted a $250 tax credit for each employee enrolled in an HSA-eligible plan. For individual insurance buyers, there's a special Georgia income tax deduction for premiums associated with the purchase of an HSA-eligible plan. The new Georgia law makes it legally clear that there is an option for small employers to contribute tax-advantaged HRA dollars to employees for the purpose of buying individual portable health insurance and/or paying for health expenses. Soon, Georgians will see products at a fraction of their current costs. The old complaints that HSA-eligible plans are simply high-deductible coverage only for the young, healthy, and wealthy is addressed with these new generation products that are allowed under Georgia law. Georgia is reflective of a much broader change afoot in this country that is unleashing the creative spirit, the entrepreneurial spirit of Americans to solve the uninsured problem. The process has started The foundation blocks are bipartisan collaboration, support at the federal level, reform at the state level, creative product development, and citizen involvement in their own health and health care, empowered financially with information and choices. The mission is clear: ensure all Americans by 2012 in a 21st century intelligent health system. The questions are: who will help, who will hinder, and who will be willing to give power to consumers over their most precious asset, their health? Thank you.